I'm Asheesh Bedi. I'm the Chief of Sports Medicine at the University of Michigan in Ann Arbor. I'm the head orthopedic team physician for the Michigan Wolverines and the medical director for the Detroit Lions. You are listening to Interview with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Asheesh Bedi, Director of the Michigan Center for Human Athletic Medicine and Performance. He is a professor of orthopedic surgery and chief of sports medicine and shoulder surgery at the University of Michigan and MedSport program. He is the head orthopedic team physician for the University of Michigan Athletics and team physician for the Detroit Lions. He's also a consultant for the NBA and NHL Players Association and specializes in both arthroscopic and open surgery for athletic injuries of the shoulder, elbow, hip, and knee. Dr. Bedi has authored over 300 articles, chapters, and peer-reviewed publications on shoulder, elbow, knee, and hip injuries in athletes.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Asheesh Bedi, Chief of Sports Medicine at University of Michigan, Ann Arbor. Doc, how are we doing today?
I'm great, Matt. How you doing?
Doing good. Thanks for being with us. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
That's a great question, Matt. I think as we chatted, in the past, one of the things that's hard as you travel the journey for medical training is sort of your short-term goals and your long-term goals. And residency is such an all-immersive process. It's 80 to 100-hour weeks, and you're really drinking from a fire hose to try to be the best surgeon you can. So for me in orthopedic residency, I'd be lying to you if I told you I didn't feel like every night my goal was simply to survive the next day. It was to be prepared for surgical cases, to feel like I was learning the anatomy, that I could continue to evolve and hone my skills to be a little bit more talented with my hands or a little better at the next operation. And the focus was broad. You wanted to be the best type of surgeon you could be in orthopedics, but without a focus of what that meant 5 or 10 years from now. I didn't know then, nor was I focused early on in residency that I wanted to be a sports surgeon. And so I think in that phase, and I don't know that I would do it any differently. I think the goal of every resident should be to try to be the best and most talented doctor and surgeon you can and learn from every provider you can and seize every opportunity. And so it's very short term and day to day, but it pays dividends as you get further out because you feel like you have those skill sets that you're not sure you're necessarily going to use or don't know how quite then.
So during your fellowship, can you kind of take us through your mentality going into your first job search and how that perspective changed in the beginning years of your career?
Yeah, great question, Matt. So as you get towards the end of residency, you start to have to define yourself. I feel like in 2020 these days, it's the exception that people leave orthopedic residency and then go out into practice. We all sort of subspecialize a little. And I had decided for me after residency that sports medicine had the best balance. And why? Because there was an element of everything. There was a lot of different joints to operate on. You had the best of a motivated patient population. Athletes want to get back to their sport. Surgeons want to be great at what they do. So what a perfect environment to have the best outcomes. But I recognized that while I had exposure in residency to collegiate sports, I didn't know what it was like to care for professional athletes. I didn't know all the challenges that go into that specific realm. And just like in residency, you want to do 2,000 or 3,000 orthopedic operations, I felt like I needed a year to do 2,000 or 3,000 sports operations to hone that craft. So I trained at the Hospital for Special Surgery in New York, which is an area that has a high density of sports medicine surgeons that are exceptional at what they do and care for a number of collegiate and professional teams. And my initial approach to that was just as you said, was about being the best surgeon. And I felt like that was kind of the first 6 months of that process. And then as you get to the later phase of fellowship, you realize you all of a sudden have to go do this on your own. And it's not just about the craft of being a good and capable and confident surgeon, but realizing all the facets of practice that you're not thinking about. Early on, as a trainee, you show up to the operating room and you're worried about doing the case, or you're showing up to clinic and worried about making sure you can make the right diagnosis. And then you realize all of the mentors and faculty around you have to worry about running a business. And how are they getting those patients into the door? And how are they balancing the economics of that and still, managing to be a margin positive enterprise while balancing it with taking great care of patients and not rushing through the process? And then you realize all the things they're doing when you don't see them. So at night, when you think you're the only one rounding in the hospital and your attending's at home, you realize, well, no, they're actually out, in the training rooms, building that reputation with the teams and the trainers. Or they're, at the national meeting, building their national reputation, or they're writing papers or getting grants. And so as I started to get to that phase, I started to realize that I'm going to have to pick an environment and pick a practice that sort of is going to allow me to try to be one or all of those things. And it's overwhelming because the opportunities that are available to you are the ones that you know about. You don't have a national, a repository or network that you can know exactly what jobs are available. Some will share with you that the best jobs are the ones that sometimes aren't posted. So you're trying to leverage your networks and relationships to learn about them, but you're also not exactly sure what you want. And so it's a balance of geography and where you might want to go, having the type of practice you want. You want to be the sports medicine surgeon like those that are in your fellowship, but you realize they built those practices over 10 or 15 years. They don't exist the first day you go out in the trenches. And so all of that was going through and continues, I'm sure, to go through the minds of like graduating fellows. So in my case, to answer your question, I looked at what opportunities were there, the opportunity to potentially stay in New York City, competitive environment, but with great talent, or the opportunity to kind of hang shingle back at an academic medical center at the University of Michigan with the idea that I could leverage some brand reputation that the university has, leverage a huge student patient population and collegiate athlete population to hone my craft, and also have the opportunity to teach and do research, which was important to me. And that was the draw for me to be back in that environment. And I guess for better or worse, 12 years later, I'm still here. So.
Now, throughout your career, did you ever consider going private practice, or were you academic focused all the way?
No, I definitely thought about it, and I'd be lying to you if I told you, Matt, I don't continue to think about it. I think all of us in our careers are probably not doing the right thing unless we're constantly reevaluating where we are. And are we happy where we are, or are we looking for something more, different, better? And I think that helps you to really kind of make a list and think about what are the things I want, and am I accomplishing them? I thought a lot about private practice, and there's lots of reasons why. I think every physician, particularly a motivated physician, is thinking about aspects of their practice, including finances. Are they really maximizing their revenue opportunity for a skill that has taken 15 or 16 years to acquire, oftentimes with substantial debt? I think in addition to finances, you think about private practice because it's your opportunity to build your own business, to have some autonomy, to really choose your path and take any step you want to take without the fear that somebody is deciding your future for you. And so for me, it's always been a consideration because especially in our field, there's lots of success that has been realized among sports surgeons and orthopedic surgeons that build large private practices with great brand reputation and autonomy to take the steps and directions they want to continue to build their business. I guess the reason I never went that direction is I kind of started in academics, and it's given me a great platform for a career in research and has allowed me to hone my skill with exactly who I wanted to care for, which is young athletes and professional athletes with challenging problems. And even though without question, there's always an opportunity cost for what you do, for me, it's likely the financial one in private practice and some of the entrepreneurship that you get with that. It's come with other intangibles of the amazing academic environment and colleagues at the university, the ability to care for the collegiate sports and learn a lot from that high-level athlete. And so I think it's a balance, and you're going to pick something, and when you pick that, there's going to be an opportunity cost whichever way you go, but you just have to embrace it and take the best out of the opportunity you have, and also know it's not a long-term marriage that has to be forever. If it's working well, it can be. But if it isn't, there's nothing lost from the experience you gain from being a really productive high-volume surgeon in private practice that then transitions to academia, or an academic surgeon who's decided that that's run its course and now wants to go into the private sector and do high-volume surgery and focus on other parts of their career.
So with that in mind, what would you say were some of the keys to your success that shaped your early career as you climbed the top of the industry?
Yeah, that's kind of you. I don't even know if I can answer that, Matt, because you said that I'm at the top of my game and I'm successful. I appreciate that. I guess I would tell you, I think it's no surprise to successful people like you that the common themes to me are always the same. I think one, always chase your passion. Don't chase finances. For me, if you try to invest yourself at being the best at what you do, the rest will follow. So if you're going to be a great surgeon and that's your mission, be a great surgeon. First, get really good at your craft, because the cream will always rise to the top, whichever venue you're in. If you're in private practices, you'll get known for your reputation by taking great care of patients who spread that word in the community. If you're in academics and you're doing great research and great teaching, that'll get recognized pretty quickly. So I think keep your eyes focused on, first and foremost, being the best at what you do. And then as you hone your craft, then you have the opportunity to start to think about how, in the limited time you have, which all of us, right, our most valuable commodity is time, how can we have the most impact? And then you can start to look at your opportunities and pick the things that make you the most effective. If that for you is being in the operating room where you're in your zone and you love doing lots of operations at high volume and being known for that, well, that might help to automatically align you to a high volume, efficient private practice scenario. If you say that you're at your best as a great surgeon, but you really are destined for education and teaching and training the next generation of phenomenal young surgeons who will point to you as their mentor, well, that might be great in an academic model. And then there's hybrids, which are so-called privatemics, that offer a little bit of both. So I guess for me, I would say I've always tried to stick close to whichever opportunity I'm embracing. If it's being a team physician, I want to be the best damn one that I can be. And if it's a surgeon, I want to be the best damn one I can be. And then for me, it's the opportunities that have matured from trying to take that approach that have, I think, given me the good fortune to be successful. And I would give you some examples that I think are really meaningful that show that to be true. Is I didn't start in this business taking care of the NFL teams and the Michigan football team. I started in this business taking care of Division I teams and Division II teams and high school teams. And if you do a great job at Friday night lights, you're a little less nervous on Saturday on game day. And if you do a really good job on Saturday, you're not as nervous about Sundays. And the reason for that is because it's the same problems and conditions. And if you become a good surgeon for the athlete on Friday night, it's no different than when I do it in Detroit with the Lions on Sundays. And they have more trust for it and more appreciation for it because you're the same guy with the same genuineness and same sincerity, and you are motivated for the right reasons. And I think that's true also of your practice. If you're taking really good care of patients and making your decisions not on economics, the economics of that will come by just having a busy and successful practice.
So what advice do you have for the graduating chief residents and fellows that are entering the professional job market for the first time?
A lot. I guess one is find Matt because you're going to give him a lot of good advice, and I mean that sincerely. But I'd say a couple other things. I think first and foremost, maybe the best way for me to answer that is to look back on my own career and say, what did I not know that I wish I did? And one is, I think we tend to understand the nature of our craft in medicine, right? We all pride ourselves on really being good surgeons, knowing the anatomy, or knowing how to operate, or knowing how to take care of patients in the clinic. But we are a little naive to the business of medicine. We're not taught, how do you make good decisions to make sure that you're economically viable? Because an economically viable practice is also going to be the one that delivers the best care for the patients and is able to provide the best access. Focused factories of care that do things well, do them well. And if you can set up your business that way, you're going to take great care of patients in high volume with consistently reliable outcomes. And so I think investing some time on the front end, even though it's really hard in residency and fellowship to carve out that time, really lean on your mentors, lean on Matthew, lean on you, lean on senior surgeons to teach you, what do I need to know that I don't know when I sign my first contract? Doesn't matter how I'm paid. Doesn't matter whether I'm working in a private surgery center or an academic medical center. How do I look 5 years from now to really build the type of practice I want? Why is that so critical, Matt? Because I think many of us immerse ourselves in the situation we're in rather than define the situation we want. And why, if I look at my own career, are there things if I rewound the clock that I would do differently? Absolutely. I think we tend to be a group of people that says yes to everything, as opposed to saying yes to the things that are great for us, but also will help to make us better or accomplish our goals. And so I think I would tell young surgeons, be a little discriminating. Think about the things that you're going to want to see in yourself 5 years from now, and it's okay to say no. It's okay to pick the things that are going to make you better. The answer isn't that I say yes to everything, and then 5 years later haven't defined anything for what I'm looking to build. I would also tell them to be patient. You're not going to have the success of the mentors that you're working with overnight. If you look at the fellowships that most of the high quality individuals that you're working with and that are listening to this podcast, the young talent that are going to eclipse me in the next 10 and 15 years, what is it that they have? They have all of the mentors of the world that have spent 10 or 15 years building really, really polished and finely tuned practices and academic careers. So, lean on them to not ask them what their life is like when they're 15 years in. Tell them to share what it was like the first 2 years or first 5 years. And you'll get a lot of stories about patients in seeing everything and taking lots of call for types of cases that they didn't ever want to be doing in their life 10 years in. But learning from them that being available and affable and accessible and learning from those hard cases early on made them really good surgeons and really good businessmen 5, 10, 15 years later. There's a lot of value to that. And you'll appreciate that the journey isn't always this easy path. There is some elbow grease and some arduousness to this that all of us have to endure. And it'll motivate your young clients and surgeons to realize that if they just stick at it and continue on those principles with good advisors like you, they'll get there.
Now, with everything being virtual right now and a lot of these national conferences going online, what advice do you have for the graduating class that doesn't have the opportunity to rub shoulders with someone like yourself, and they're trying to figure out that whole outreach process right now?
That's a good question. The whole world's changed, right, Matt? And I feel like COVID changed it for us, where it accelerated telehealth and communication. I think none of us knew how to open, or at least certainly in medicine, few of us had a Zoom app on our phone, and now everybody's got it everywhere. And I think the reality is just encourage them that, just like everything else, the silver lining of the COVID crisis, if there is one, is while you're not going out and networking in person, it's dramatically increased the availability of individuals through the virtual web. Everybody's a click away. You can click tomorrow and meet 10 surgeons. You can access virtual programs and meetings. I feel like I have learned 10 times more sitting at home on the computer and taking notes on a 3-hour session on the business aspects of healthcare and leadership than I would in person. While I'm missing out on some of the social networking that occurs, there's 10 other things that I can do during that time in the virtual flow. And I would encourage them, don't let this be a period of isolation. Use this time to email, to LinkedIn, and Zoom, and connect to those individuals. They're just one click away. And frankly, they're going to have more time and availability for you now than sometimes they will at the meeting, where it's a deluge and social inundation of a lot of small interactions, but not very meaningful ones.
Can you share your journey on how you got involved with the Lions and then also the Players Association with the NBA, NFL, and NHL?
Sure, Matt. All those things are no surprise. They're time and relationships and, working at what you do. I am, as I shared, at the University of Michigan. I've been here for 12 years. I'm the chief of sports medicine and care for the University of Michigan football teams and some other teams at our program. Through that process, as I've continued to be a sports medicine physician in those venues, started to have the opportunity through colleagues to also contribute with the Detroit Lions. I initially started on that path because I had one area of a unique skill set in so-called hip preservation surgery, which is a young field that's caring for hip injuries in young athletes. So I initially started as a consultant, offering that expertise to the team. And as you become available and you start to care for those athletes, you start to broaden your involvement, and that has gradually grown into the opportunity to care for that team. And similarly, as you care for athletes across the country, your reputation starts to grow with the player unions, and hopefully you're sought out and thought of as somebody who can offer a thoughtful second opinion. And so for the NHLPA and the NFLPA and the NBPA in particular, where I do most of this work, I'm a thoughtful second opinion for athletes that get an opinion with team physicians and say, you know what, it wouldn't hurt for me to run it by that guy because he does it for the Lions and he does it for Michigan. And I think, kind of where we started on this podcast, I don't think that has happened any other way other than sticking to the number one principle I hope the guys leave this call with and this podcast with, which is just a focus on doing what you do well and with integrity. And I think athletes will know that. They will know that I'm not going to change my opinion. My duty is to them. It's to the player. And if I'm giving them an honest opinion and always doing right by them, the team will appreciate it, the team physician will appreciate it, and the player will appreciate it. And that will grow your reputation because you'll always be known as somebody who's shooting it straight. And even though there's this perception, right, that for some reason what I would render would be a different opinion than the team physician, than what the player would want because we're all disaligned in goals, the reality is that's just not true. Everybody wants the player to be healthy and perform really well. And if you just get on the same page, that'll pay in spades as you get down the road, because nothing is greater credibility than the respect of your peers and the respect of your patients. And I think everyone who you are working with, Matt, and are advising to embark on these careers, they all have the skill set to do that so well. The hard part is the surgeries and having the knowledge. The easy part is just staying true to focusing on what you want and being the best at your skill.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.